of our five senses, many people consider our eyes the most precious. If you wear glasses and wish you didn't have to, laser vision correction might just be for you. Dr. Jeffrey Gold is a board-certified and award-winning ophthalmologist and the owner of Liberty Vision. He's here today with Wallace Pringle, a chemist who had the procedure. Gentlemen, nice to have you both here.
Thanks for having us.
Wallace, let's start the conversation with you. What was your vision like before you met Dr. Gold?
I was extremely nearsighted, and I wore contact lenses for about 30 years before seeing Dr. Gold.
Wow, and was there a moment where you just said, I don't want to do this anymore, there's got to be a solution?
There were many, I'd say, minor moments that added up, and probably the one moment that broke the camel's back, if you will, was nothing cataclysmic. It was just the realization that I was doing this every day, every night.
It's about time.
It's about time.
And Dr. Wallace said he wore contacts for close to 30 years. New information about contact lenses.
Yeah, I want to talk a little bit about a new CDC report on contact lens infections that was published just November 13th. And they've declared November 17th through 21st the first annual Contact Lens Health Week.
Oh.
Turns out every year almost 1 million doctor visits for eye infections are made in this country, costing about $175 million in direct eye health costs. Wearing contact lenses is the largest single factor in eye infections. And this affects women more than men.
Really?
63% of office visits are women. 55% of emergency room visits with eye infections are women. And they've concluded that the infection occurs when germs invade the cornea, when lenses are worn too long, not cared for correctly, sleeping in lenses, which I've been warning your viewers about for a long time, not cleaning and replacing the storage cases frequently.
Oh, I think people probably forget about that
That's
one.
right.
I mean, and it's all your hands. You're touching the lens, you're putting it right in your eye.
Well, the recommendations that they've made to prevent infections, number one, seems self-evident, but it's wash your hands.
Before you even start, right?
Before you start. Take your lenses out before you go to sleep, showering or swimming. Rinse the lenses in disinfecting solution every time. Rinse the case with solution and let it dry upside down. Replace the case every 3 months. Don't top off the solution and carry spare glasses.
There you go.
This is all about reducing eye infections from contact lenses.
But we have a better solution here.
Better solution.
We're going to talk a little bit about Epi-LASIK versus LASIK.
Right. In Epi-LASIK, and I think we have a graphic that shows that, in Epi-LASIK nothing is cut. In the picture on the right, a corneal flap has been made to do LASIK, and in the picture on the left, you can see that there's no cut that was made. We just use a blunt tip separating device to take off the surface layer. Those cells are called epithelium, and that's why the procedure is called Epi-LASIK. Because of no cutting, it's safer during the time of the procedure. And if we can turn to this, that graphic shows...
That's a little snowplow graphic, right?
Just like a snowplow. It takes off that surface layer. And if we can show a shot of this model that I brought with us, in LASIK, the cornea is cut and a flap is folded back. The laser correction happens in this part of the cornea. The flap goes back down and the edge seals overnight. But the interface between these two layers never completely heals. So for the rest of that person's life, if they get hit in the eye just wrong and the flap comes loose, they've got 1 hour to get it fixed, or they're going to need a corneal transplant. So Epi-LASIK is safer for the rest of your life as well.
Makes sense. And Dr. Gold, who would be a good candidate for laser vision correction?
Just about anybody over the age of 18 who has finished growing, as documented by seeing their last 3 eye exams, which is what I require. I have them get their last 3 eye exams for me. And if they've stopped changing and the prescription has slowed down almost completely or stopped, then they're a good candidate for laser vision correction. Unless they've got some pre-existing corneal problems, corneal degenerations, which we determine when they come in for a free screening, and we do a few scans which show that corneal degeneration if it's there, or if their corneas are too thin, then they're not candidates for the procedure. But everybody else is.
All right. And Wallace, how about some words of advice for someone who might be considering the procedure?
I think do it would be the number
Don't
one.
hesitate. Don't wait 30 years.
Don't do what I did. And that there, of course, as with any medical procedure, there are concerns, but really on the balance, it is well worth it.
Life-changing?
Life-changing, absolutely.
Very good. And doctor, I know your practice is a little bit different because people deal with you right from the start.
Right. When people come in, I'm the one who does the screening exam and determine whether they're a candidate. I explain the procedure. When they come back for their pre-op exam, I do all of that work as well, except for one scan, which my assistant Silvana does better than me. And then I do the surgery, of course, and then I do all of the post-operative care for as long as they want me to keep me for their eye doctor.
Sure. And doctor, as always, you have a special deal for our Connecticut style viewers.
Right. Anybody who calls in and mentions this program gets a $200 per eye discount. And we've also extended that to all first responders, active duty, and retired military.
Very nice. Well, let's put some information up on the screen. If you'd like to get a hold of Dr. Gold at Liberty Vision, you can call 203-281-5745 or visit libertyvision.net. You can find them on Facebook as well. And Wallace, so happy you could see again.
Oh, nice to be seen.
Thank you for being here. Thanks for sharing your story, doctor. We'll see you soon.